Good morning, everybody. I'm so excited today because we have a special guest with us on the interview. It's Representative Patt Maney, who represents the southern end of Okaloosa County, which of course includes Niceville, Valparaiso, Blue Water Bay, all of our southern Okaloosa County area. And so, General Maney, thank you so much for being on here today. And if you would just kind of give everybody a little bit of a primer about who you are and what you do over in the state capitol for us as a representative.
Well, first, Christopher, thanks for having me on. It's the first time I've been on your podcast, and I look forward to it. I've always been felt like a very integral part of the friendly people of Niceville and Valparaiso and Blue Water Bay. I've got a lot of friends there, and it's exciting to be part of this broadcast. And really, thanks to all of your listeners for giving me the opportunity to represent them in the Florida House. The Florida House has 120 members. The Senate has 40. I think they like to remind us that their vote counts for 3 of each of ours, just doing the division. But it's fun. There have been fewer than 4,000 people who've had the privilege of serving in the Florida House since we became a state, so it's kind of exciting to be here. And really, every time I walk into the House chamber, it's just kind of amazing to think that I'm here helping to make laws to benefit the whole state and, of course, to represent and help the people of Okaloosa County. When I ran, I said what some of my priorities are, and I've worked those priorities. I've been pretty successful in helping to fund projects needed around the county at large and to some extent in discrete areas. But I've been focused on things like education. I've been very successful in helping the college education and helping the school system. I've gotten several projects funded from them and also for the Shoe Foundation, which I know you know Paul Shoe and his work, Amanda's work in helping Okaloosa County. But I've also been very interested in environmental issues, water quality, sewage, not a very exciting subject, but a really important one, roads, because we all feel the challenge of crowded roads, trying to get back and forth. So I've worked on all of those issues in particular. A passion that I've had, though, has been addressing mental health. You may remember when I was a judge, I was able to get the mental health diversion program started. And before that, I started the Veterans Court and the mental health courts in Okaloosa County, both of which are still in operation. They're very judge dependent, and I appreciate the judges who have continued that work now that I've aged out or matriculated or whatever you want to say in leaving. But over here, specifically this year, as in previous years, I've worked on several bills for the Florida Tax Collectors Association. They as an organization and as individuals have been very focused the last few years on making their processes more user-friendly. So that previous legislatures had given them kind of expanded work. They're a fee office generally, but the tax collectors have really worked hard at finding ways to help the public. One of the bills I'm working on for them this year, for instance, really just addresses a discrete bill for military people who may move frequently and even within our area because of the on-base housing shortage. A lot of Air Force members first rent in the community until they can get a place to move into on base. Sometimes with those frequent moves, motor vehicle registrations get lost in the mail or don't get properly forwarded. Under current law, the taxpayers, are required to pay a $10, and we're getting rid of that. Also, for all of our taxpayers at the lower end of the economic income levels, there's a fee if people choose to pay their taxes in increments, and we're getting rid of that. So people who are having trouble paying their taxes aren't going to have to pay a fee to make payments. So I think that's really good. We're also trying to, I've got a bill to simplify and therefore save money when somebody dies with a small estate, to not to make it easier for people to transfer things like a car title without having to go to the expense of a probate and that sort of thing. Several years ago, I think it was 2020, the legislature allowed Court of Appeals judges to have an alternate headquarters, to kind of let the appellate judges have a private office where they live rather than kind of forcing everybody to come to a central place where their courthouse was. But just with geography, some people live closer to another county's courthouse than they do to their own courthouse. You know, if you live in Freeport, you may be closer to the Walton County Courthouse, or Blue Water, you may be closer to the Walton County Courthouse, or the Crestview Courthouse, or the Shalimar Administrative Building. So it allows people to have offices in those different locations rather than just limited to their home county. They can go to a closer courthouse and still get paid whatever the closer mileage happens to be. And that keeps the District Court of Appeals judges more connected with their communities rather than having everybody, for instance, in our area, everybody would have to live in Tallahassee. I've been involved, as I mentioned, with Veterans Court and Mental Health Court, specifically as an instigator of those courts. But we also have drug courts here in Okaloosa County. This is a long answer to a short question, but what we're doing on that is we're making sure all of those courts have the same confidentiality, public records exemption, so that if you're in one of those specialty courts, you have to fill out an application, and if you put on yours that you were suffering PTSD, for instance, from sexual trauma, and you're self-medicating because you also have a substance abuse issue, that kind of information shouldn't really be subject to public disclosure, and it would discourage people from taking part in these specialty courts. I've got a couple of local bills, really more focused on the north end of the county. Both of them are. One with the North Okaloosa Fire District. Their voters had approved a referendum to have impact fees, and that has to be approved by the legislature. So I'm just doing that. And then the Dorcas Fire District has had administrative problems for several years. They don't have sufficient people or money. So the county is looking to take them over, and I'm trying to facilitate that for them. My big issue is Baker Act reform or modernization. I've worked on that as a judge for 10 years, and I've worked on it over here for 4 sessions. This will be the 4th. And I'm very hopeful that we'll get it through this year. It's going to be a modernization. I'm not actually the sponsor of the bill, but I'm the one carrying the bill. The speaker decided that it would be a committee bill. And I'm very hopeful. Both the speaker and the president of the Senate and also the governor have talked about the need for mental health modernization. So I think we'll get that through. And then one quick little thing for particularly for any of your ladies who are listening and viewing this podcast. We've been a state since 1845. In that entire time, we've never had a female presiding officer as the president, as the speaker in the Florida House. And this year, the class that will be in office in starting 4 years from now, they're going to have the first female speaker in the history of Florida. A lady named Kennedy has been elected as that class leader who will become speaker if the Republicans maintain their House majority.
Interesting.
So that's not such a quick recap, but you asked a short question and got a long answer.
Hey, there's nothing wrong with that. I enjoy hearing you talk about all the stuff that you're doing. And I think one of the things that I really wanted to focus on today, especially because you've been working on it for 4 years, is the Baker Act reform and kind of the conversation more generally around mental health in our state. And I guess I'd really like to start by asking, why is mental health reform in the courts and kind of really just in the way that we organize society in general, why is that so important to you?
When I was a judge, one of my responsibilities was to do Baker Act cases, and I saw the anxiety and pain of family members who were then having to ask the court to involuntarily order somebody to be evaluated and perhaps given treatment. And the process didn't work well. And it tended to make family relationships worse for a while because people resented being ordered to do something. The process did not work well. Frequently, the 72-hour evaluation period was the only thing they received, so they didn't really get treatment. And there wasn't follow-up. There wasn't pre-crisis intervention, and there wasn't post-crisis follow-up. It just didn't work well, and we're spending a lot of money. And people who have serious mental illness, persistent mental illness, tend to rotate through the system. They're involved with the court system, perhaps for a crime. Then they get out, they're involved in the court system for mental health care. Frequently, people get off their medications and get back in trouble and go back into the court system and the jail. The largest mental health facilities in the state, well, the largest mental health facility is not a state hospital, it's the Miami-Dade County Jail. And our Okaloosa County Jail has a large mental health population. And for our local taxpayers, it's really expensive. The medicines are expensive. People are getting involved because they can't navigate the system. And it just seemed to me we needed to modernize and update the system. Actually, 20% of the mental health patients eat up 44% of the mental health services. So we really, in my view, we really need to concentrate on those high users. And that's why I want to have a piece at the beginning and a piece at the end, so that hopefully we can interrupt coming into the system. And if they come in the system and get out, then have the follow-up care so they don't have to immediately or very shortly come back into the system.
So these high users, would you say that are 20% of the people, but 44% of the cost? Like, if we're able to reduce that to a more normal number, what kind of savings are we going to see as taxpayers here in Okaloosa County? Is it what order of magnitude, for example?
Well, I'm not sure that I can say that it will save money, because I think we also need to have the before and the after care,
Okay.
which I think we can fund by cutting down the cycling.
Okay.
There currently is a member of the House who has a constituent who has a 17-year-old daughter who has previously stabbed her mother. She has previously tried to commit suicide. And in this school year, she's been Baker acted 15 times.
Wow.
To me, that's an example of a high user where they get evaluated, but they don't get treatment. I don't think that's good for the person. I don't think that's good for the family. I don't think that's good for the taxpayer. And I don't think that is good for public safety for the community. How in the world do you get Baker Acted 15 times in, 7 or 8 months? 5 months, maybe?
And you
School
could,
starts sometime in August, and here we are mid-January. I mean, we're spending a lot of money, but we're not spending it smartly, and we're not really improving the situation for any of those, for the patient, for the family, for public safety, for the taxpayers. I mean,
so
it's a lot of work,
those
but it's not
70,
working.
those 72-hour holds, basically, if she's had 15 of those, but she's not gotten past the evaluative process, right? So every time she goes in for one of those 15 of those Baker Acts that she gets, they basically say, yep, she's still got problems. Is that essentially what's happening?
Well, there are two things. For one, the current state law says a person has to be in imminent danger of serious bodily injury to themselves or others.
And
So somebody who's been through the system knows the magic words. Oh,
okay.
I was just angry. I would never hurt anybody. Well, that's not imminent. Another problem is with that definition. 52 years ago, when the Baker Act was passed, we didn't have internet. We didn't have cyber stalking. As young people would say, it wasn't a thing in those days. Well, it is a thing now, but you can't address that because it's not serious bodily injury. It's harassment, it's psychological injury, but it's not bodily injury. So we really need to look at the system and not just change happy to glad, but change the process.
So what would it look like? What would a perfect post Baker Act reform look like from intake to output in your perfect world?
One of the provisions in this bill this year is to require, and you're going to be surprised to hear that it's not already there, but we're going to require a treatment plan and a warm handoff. That way the person knows what they have to do to stay stable and who to go see. I mean, I know you relatively recently became a parent again. And before your wife got out of the hospital, either the physician or a social worker would have come by and told her, you need to see your OBGYN. You need to take the baby for the well baby checkup. You need, the things that a new mother needs to know and what kind of timeline. We don't currently do that for mental health patients. Now, if we do it for somebody who's, quote, normal, why would we think that somebody who's having a mental problem would successfully do it with something less? I mean, to me, I'm just a former county judge. I'm not real smart, but it seems to me we ought to make sure that we take care of the people who are having troubles. If you have cancer, we take care of you. If you have a heart attack, we take care of you. If you have a psychotic break, we don't take care of you. We expect that you're as normal as, I hate to say it, as you and I are, because that may set the bar too low.
But it is very interesting because you bring up a point that, a heart attack, if my neighbor has a heart attack, I mean, that's really bad, but it doesn't affect my day-to-day well-being in the way that somebody having a mental break and like coming, coming to my place of business with a gun or something would, right? And so
Exactly.
it's interesting that we would not cover that more aggressively because it's a social problem, right? Like, not to get all theoretical, but like Rousseau talks about, the social contract we have with one another. And for us to kind of avoid one piece of it while being heavily involved in another one, at least from the medical side, it seems like we have a unequal footing on how we deal with those things.
Well, I think we've isolated the problems too much, put things in a different basket or stovepipe, and really it affects everything, as you mentioned. But both of them have an impact on all of us because of the finances involved. And each of those has an impact on that person's family. So, I mean, I just think we need to look at it in a more holistic way.
I've had some individuals talk to me, and I know in Texas we don't really do this anymore, not since the 60s. Back when I lived there, but we don't do it here either. That kind of surprised me because we have all these large former asylums in Texas, mental hospitals. Is there any talk in the state legislature about bringing those back as a way to care for people, or is it continuing to be more of a in-hospital or outpatient sort of focused idea?
The law changed with a Supreme Court case called Wyatt versus Stickney. Many of the states and many of the state hospitals really were warehouses.
Okay.
And the theory was we're going to close down state hospitals or reduce state hospitals and count on community care. And that the care is better the closer the patient is to their family and loved ones and friends. Well, that was a good academic theory, but what happened is the local communities didn't pick up that cost. Well, now they're carrying that cost through the public safety law enforcement community, jails. But that's really not, jails don't provide aftercare in any event. They want to get people taken care of and stable enough to get their criminal case over. But they're really not designed to be a long-term mental health facility. And like I said, jails cost a lot of money. I don't know if you've seen the CBS News special out of Miami-Dade called Warehoused, about a young man with documented mental health problems who was bizarrely charged, I think, with littering. He drove felony littering. He drove his pickup truck into a pond, and that was the littering. He was Baker acted. He had 2 different competency exams. He was sent to state prison. He got back on meds, was doing well, so they put him in a dorm where he could work. When they sent him out on a landscaping job because he had previously worked in landscaping, he was given a chainsaw. He started the chainsaw and committed suicide.
Wow.
As horrible as that incident is, to me, again, it points out that we're really not doing a good job by talking about imminent danger that limits mental health providers from looking at the history of the person. Not that you've been Baker acted 3 or 4 or 5 or 2 times, but how are you right this minute? Well, right this minute, you may present well, but that doesn't mean that you are well. It means that you've been through it enough that you know what answers to give.
And so I guess we've had a lot of heavy talk about the mental health and kind of how we've dealt with stuff in the past, but as a state legislature, as we're moving forward, what are you most excited about in the state of Florida or for our district for the future?
Well, let me come back to that. And I know we may be running out of time, but let me come back to that. The Senate president has proposed a bill called Live Healthy.
Okay.
The House hasn't taken it up yet, but everybody's certainly looking at it closely because it's an expensive bill.
Okay.
But one thing that it does is it addresses the shortage of mental health workers.
Okay.
And it calls for the creation of a medical school that's focused on psychiatry and mental health workers. Now, whether that's going to be something at one campus or spread out between different higher educational organizations, I don't know. I'm not that intimately involved with that detail. But I think it is important to realize that we realize that we have a shortage of mental health workers, and you can come up with the greatest plan in the world, but if you can't implement it because you don't have the bodies, the trained people, it's not going to make any difference. So we are working on that too. Now, you ask a question locally, and let me come back to that.
Okay. I wanted to know, as a state legislator, what are you looking, what brings you hope and excitement for the future in the state of Florida that you guys are working on there at the state capitol?
Mental health. I think we have fewer mental health workers and fewer mental health beds now than we had 40 years ago per capita.
Okay.
I mean, it's just a real problem that we've got to address. It's not jazzy, but it's important. And I think we're going to see major movement. Speaker Renner is focused on that. The president of the Senate's focused on that. And we're going to make major long-term progress on it this session, I believe.
And do y'all have a price tag associated with this mental health initiative that you guys have, kind of holistically speaking?
Well, the Senate bill is a $1.1 billion bill.
And so, for reference, what is the whole budget for the state that you guys put together typically?
Well, we don't have it put together yet, but I think the governor's budget is about $118 billion.
So roughly,
that's a lot of money.
Yeah, it's 0.8% of the entire state budget, basically, if it comes out to be $1.1 billion.
That's a pretty substantial investment.
And what would we? So you said they're looking at putting a psychiatric medical school together. Maybe the details aren't firmed up just yet. But in your perfect world, does that come to UWF, or they expand Northwest Florida State College pretty extensively?
I would think UWF will play a role in that. I am pleased, and you didn't ask me about projects, but one of the things I've sponsored both last year, where I got over $1 million, and this year where I'm asking for more than $1 million, is to create a civil engineering school at UWF, but they're going to also have it at the Fort Walton campus.
Cool.
With both communities growing as much as they are, not only militarily and with military contractors, but just engineers to do subdivisions and all of that. We really need a source for more civil engineers. And UWF has stepped up, and they're ready to do it. They've already had the money and done the building and gotten the equipment and all that. And now they just need to get going, hiring the people and getting the students to enroll and all that. But we really need engineers locally.
And so what would a timeline on, hey, we're going to do this, CE program at UWF to they open the doors and the first class starts? Do you have an idea what that might look like?
I think it'll start fall of 2024. It'll start this fall.
Okay, so really quick.
They've worked hard on getting it ready over at UWF. They just need the final. They're ready to go. They've done all the prep work. They've spent the prep money, and now they're ready to hire people and enroll students.
Perfect. What have I not asked you about that you're excited about in this session?
Well, I've been really gratified. We've had so much public interest. People contacting me, people coming over to meet with me. everybody from the school boards to county commissioners to ordinary citizens. This has been so much, we've had so much more public interaction than we did in my first session during the COVID crisis, and even after that. People were kind of leery about getting in crowds or public places, but that seems to have dissipated, and I'm excited about that.
So if people want to get in contact with you, ask you questions, or provide feedback on what they want to see from the state legislature, where can they contact you?
Well, the best place is to call my office in Fort Walton Beach. Andrew will take care of them and relay the information to me. If they contact me here in the capital, Ian is my aide who's over here with me. He lives in Destin, and when we're not in session, he's back in the Fort Walton office. But they feed the information to me and schedule appointments, and both here and in the district. Of course, I'm not in the district as much when we're in session, but I go home just about every weekend and see people on Fridays or Saturdays or Sundays. Come back over here Sunday afternoon.
Perfect. And I guess last question for you, your Kentucky Wildcats, are they going to win a national championship in basketball this year? And if so, by how many points?
Ooh, what a question. I am a Kentucky Wildcat, and most people who are Kentuckians support football and basketball, but football sometimes disappoints us. We're always excited about basketball, and we'll do well. They're doing well now, and I expect them to go to the tournament.
All right. Well,
I don't know. I'm not going to give you a point spread.
All right. I'm trying to get my bets in early. You know how that is. I'm busy. I want to stay busy, and so.
But you also want to stay legal.
I want to stay legal. I want to stay busy, legal, and profitable. That's the goal.
That's the goal. Thank you so much for having me.
Well, I appreciate it, sir. Talk to you soon.
Yes, sir. I hope so.
All right. Bye.
Bye.